It's an honor to be able to speak to you on contraindications and precautions. I've included my email address, office number, and pager number on the title slide, and I'm going to be giving a copy of the PowerPoint to Valerie to distribute and make available for those who would like. When I first came to Mayo Clinic decades ago, I was surprised to hear my colleagues had a whole variety of ideas of what were contraindications or precautions to vaccines. I heard of people who weren't giving vaccines because the children hadn't had a well child visit, children who wouldn't get vaccines because their mothers were pregnant, children who wouldn't get a vaccine because the mother was breastfeeding. All sorts of strange and different ideas of reasons why a patient shouldn't get a vaccine that day. So I think it's very important that we understand contraindications and precautions. I have a number of learning objectives for us over the next 15, 20 minutes that you'd be able to differentiate contraindications from precautions and feel confident about what's a contraindication and what is a precaution, to identify best practices in finding true contraindications and knowing where to look and making sure that you're on solid ground when you say you should not be getting the vaccine. And relate best practices in interpreting those contraindications. That is, how do we actually apply it to the patient in front of us? Now, I'm going to give you a definition, a synonym, an example, and a use of the word indication first, which is like the opposite of contraindication. A vaccine might be indicated. This means who should receive this vaccine. That's a good working definition of indication. Another term that we might use for indication is recommendation. For example, everyone 12 years and older should get the COVID-19 vaccine. That's an indication or recommendation. And the indication could also read, this is for everyone 12 years and older. That's the indication of the vaccine. Contraindications is different. It's the opposite. Who should not get this vaccine, at least right now in their current situation. Another word for contraindication is prohibition. This person is prohibited from getting the vaccine. In no way should this person get this vaccine. It's not up for discussion. No one with an allergy to PEG should get either the Pfizer-BioNTech mRNA COVID-19 vaccine or the Moderna-BioNTech mRNA COVID-19 vaccine. Those are contraindications. The PEG allergy is a contraindication for these two vaccines, the Pfizer and the Moderna vaccine. So here's a definition, a synonym, an example, and use of the word contraindication. Now let's juxtapose that to precaution. Precaution is really a different sense. Who should discuss with the clinician this vaccine first before getting the vaccine? A synonym for precaution would be the need for consultation, the need for a discussion. And here's an example. A person with an allergy to polysorbate has a precaution for either the Pfizer-BioNTech mRNA COVID-19 vaccine or the Moderna-BioNTech, actually cross that out, that's not a BioNTech, Moderna mRNA COVID-19 vaccine. Polysorbate is a precaution for those two vaccines. Now, there's a problem and there is a solution. Many claimed contraindications for vaccines are false ones. Staff should not trust, recall, textbooks or package inserts. And yes, I went there. Your staff often will pull out a package insert on a vaccine and point to something that looks like a contraindication. But actually in modern practice, we do not rely on what the manufacturer packaged with the vaccine as a basis for the contraindication or precaution. The best evidence resource, the best evidence-based resource is the Advisory Committee on Immunization Practices, or ACIP, and not the Food and Drug Administration, or FDA. The Advisory Committee on Immunization Practices, or ACIP, is an independent committee of volunteer experts. They meet officially 3 times a year, but they work year-round to generate recommendations for vaccines as well as their contraindications and precautions. They publish on the Centers for Disease Control and Prevention website and in the MMWR. They publish a table of contraindications and precautions that all of us need to really have as our go-to resource when talking about who should not be getting vaccines or who should be at least having a discussion with a clinician with regards to that vaccine. I get there by typing in cdc.gov/vaccines into the browser and then look for the general best practice guidelines on immunizations. And I go to table 4-1, which is entitled Contraindications and Precautions to Commonly Used Vaccines. This table 4-1, Contraindications and Precautions to Commonly Used Vaccines, lists all the vaccines in the routine and at-risk schedule, with the exception of COVID-19, and then lists the contraindications in the 3rd column, and in the 4th column, the precautions. So here we see, for example, at the bottom of the slide, for diphtheria, tetanus, acellular pertussis, DTaP, that severe allergic reaction or anaphylaxis after a previous component or vaccine component is a contraindication to DTaP. Progressive neurologic disorder, including infantile spasms, uncontrolled epilepsy, progressive encephalopathy, is a precaution. We defer the DTaP until the neurologic status is clarified and stabilized. That table goes all the way A through Z to zoster. Here for zoster, we see that contraindication is a severe allergic reaction after a previous dose or a vaccine component, and a precaution is a moderate or severe acute illness with or without fever. Following the table is a whole host of abbreviations and footnotes that are important in figuring out how to apply or make operational the contraindication or precaution. Now, I want to walk you through the steps to get to this all-important table. Type into the browser line cdc.gov/vaccines, click Healthcare Professionals, and click General Best Practice Guidelines for Immunization. Then click Contraindications and Precautions. Scroll to table 4-1. Let's, as a demonstration, do just that. Now, with the magic of Zoom, I'm going to see if this works, but if at this point, I'm going to stop sharing the slide and share my Google screen. And again, I just go up to the address bar, type in cdc.gov/vaccines, scroll down to healthcare professionals, and then I get to, actually, I think I double clicked too many times. When I click here, then I scroll down to the general recommendations, general best practice guideline for immunizations. I click here, and I scroll down to contraindications and precautions, and then table 4-1. And there's the table, starting with diphtheria, tetanus, and TD, going all the way through the live attenuated influenza vaccine, down to rotavirus, varicella, and zoster. And as I mentioned, there's all these footnotes that are important for interpreting. This is how I get to this table. And frankly, not a week goes by where I'm not examining this table and looking up a particular vaccine or contraindication. I make no effort to memorize this. I think it's impossible to memorize this. And I think all too often we tend to rely on our memory rather than looking it up. And I really want to encourage you to feel confident in finding this table and looking it up. Let's go back to the slide set. I'm going to stop sharing for a second. Then I'm going to reshare to find my PowerPoint. And we're going to continue. The top of the slide should read best practices. I want to go over a few best practices in using the table. First of all, use the footnotes. They're not just academic, they're actually clinically relevant to you working in the office with a particular patient. Use the footnotes. Consider clicking the citation, the second column, for details. You remember we glossed over from the abbreviation in the first column over to the third and fourth column, but the second column actually has the citation and usually takes you to the ACIP recommendation for that particular vaccine, where you can get more details on that vaccine's recommendation, contraindications, and precautions. Remember, contraindications are prohibitions. They're the people who shouldn't be getting the vaccine. Precautions call for consultation. Here, you would want to work with the clinician to make a decision about that particular patient. Weigh the risks and benefits for the individual. Document the discussion. Standing orders or nurse protocols usually exclude both contraindications and precautions, and that can get confusing because many people will remember a standing order that kicked the patient out. But if it kicked the patient out because the patient has a precaution, that doesn't mean the patient shouldn't get the vaccine, but just that a consultation should take place first. Now, COVID-19, obviously, our days and nights are filled with dealing with COVID-19 and COVID-19 vaccines. You need to know where to find these contraindications and precautions. You aren't going to find them in table 4-1. These vaccines were really just developed and recommended since December, and the ACIP and the CDC just haven't had time to update its general practices with this information. You're going to find these instead in documents online called interim considerations. And here's the address where you're going to find the precautions and contraindications. I'm going to show you how to find these. I usually find them by typing in the search bar of the browser, interim considerations of COVID vaccine. Let's just do that right now. I'm going to share my Google screen, and up here, I'm just going to type interim considerations COVID vaccine. That's all I type in the browser. Again, this is something I do at least once, if not more times a week, to find recommendations about the COVID vaccines for my patients and our practice. Go to this top hit, interim clinical considerations for use of COVID vaccines, and you're going to find the contraindications and precautions here for the COVID vaccines. And you can either go to a summary document or for the specific documents to find those. Here you'll find the specific contraindications and precautions for the vaccines on this page. Click contraindications and precautions, and then it will list the contraindications and the precautions right here for the COVID-19 vaccine. It also includes things that are neither contraindications or precautions. This is important because there are some things that might be confused with a contraindication or precaution. You need to feel confident that you can eliminate those just as well. Let's go back to our slides. So you're not going to find the contraindications in table 4-1. You're instead going to go to your interim considerations, just as I demonstrated. Note, in addition to the false ones that you saw with COVID-19, there's actually common false ones for all of the vaccines. For example, moderate or severe illness with or without fever is not a contraindication to vaccine. It's a precaution. You need to consider the benefits of the vaccine and the risks in light of the illness. It's usually a precaution, never a contraindication. Pregnancy, occasionally a contraindication, often a precaution, but for several of our vaccines, neither. In fact, pregnancy may be an indication for a vaccination such as Tdap. Commonly believed false ones make up a second table that I find very useful and educational. It's table 4-2. Let's take a look at that. I'm going to stop sharing my slide and go back to my browser. And we're just going to take a look here. Remember how we got to that table? We're going to do it again. We type in cdc.gov/vaccines. We're going to scroll down to healthcare professionals. We're going to scroll down to general practices, scroll down to contraindications and precautions. But now, instead of stopping at table 4-1, we're actually going to go all the way down to the next table, 4-2, for false contraindications and precautions. Conditions incorrectly perceived as contraindications or precautions of vaccines. For example, a mild acute illness or with or without fever is commonly misperceived as a contraindication or precaution, but is no reason not to vaccinate. A lack of a previous physical exam in a well person period is not a reason not to vaccinate. Being on antibiotics is not a reason to withhold a vaccine. Being preterm, recent exposure, infectious disease, et cetera. And then there's these vaccine-specific ones that can be very helpful just by saying out loud, prematurity is definitely not a contraindication for rotavirus. That's helpful for you and your staff to know for sure that it's not a contraindication. So I find this table, 4-2, almost as useful as 4-1, knowing what is not a contraindication with confidence as compared to seeing it in this table. Let's go back to the slide set. Now, this table 4-2 that lists these false or commonly misperceived contraindications and precautions, very useful. But I also want to move to some interpretations of table 4.1. Laypersons often confuse reaction with allergy. It is very common for a person who's had a large local reaction to vaccine to assume they have an allergic reaction. You need to teach and practice that large local reactions to vaccines are common and not our allergic reactions, never develop into life-threatening anaphylactic reactions. They're common. They usually occur hours or days after vaccination, and they're local. They don't generalize to the rest of the body. Whereas allergies are incredibly rare to vaccines, occur immediately, usually in the first 15 to 30 minutes, if not the first 4 hours, and are generalized to the whole body. So the rare, generalized, and immediate. Vasovagal symptoms can also be confused with anaphylaxis. COVID-19 vaccination efforts illustrated this. We frequently were called to a patient who is having a vasovagal reaction rather than anaphylactic reaction. Fainting and hyperventilation are the hallmarks of vasovagal symptoms rather than anaphylaxis. And the CDC actually produced a useful table that is not just informative with the COVID-19 vaccine, but actually is informative for all of the vaccines that we give. This table appears in the clinical considerations in that interim table. Here's the address bar. It's Appendix D. Potential characteristics of allergic reactions, vasovagal reactions, and vaccine side effects following the COVID-19 vaccine. And you should really take time to read through Appendix D. It'll not only inform the work that you're doing with COVID-19, but it'll inform your work you're doing with all of your vaccines. This table begins with characteristics such as the timing after vaccination and points out the allergic reactions, including anaphylaxis, for the most part occur within 15 to 30 minutes of vaccination. Now, vasovagal reactions such as hyperventilation or fainting can occur within 15 minutes, but most side effects, local and systemic, typically take a day or two or even 3 to develop. with most occurring the day after vaccination. So just as I said, a large local reaction is not an allergic reaction. A large local reaction more typically develops 1 to 3 days after vaccination. This table continues talking about signs and symptoms. Allergic reactions, there's often this sense of impending doom. A vasovagal reaction often will have the sense of warmness or coldness, whereas we actually see true fevers, chills, and fatigue as vaccine side effects showing up a day to 3 later. Skin symptoms, 90% of people with an allergic reaction will have pruritus, urticaria, flushing, and angioedema, whereas with vasovagal reactions, more paleness, sweating, clammy skin, occasionally a sense of warmth in the face, whereas vaccine side effects tend to show pain and redness and swelling at the injection site, lymph nodes at the same arm of vaccination. Neurologically, there can be some shared symptoms between allergic reactions and vasovagal reactions. Allergic reactions can show up with confusion, disorientation, dizziness, lightheadedness, weakness, and loss of consciousness. Dizziness, lightheadedness, and fainting are actually the hallmarks of a vasovagal reaction. Headaches showing up a day or two later are neither allergic reactions or vasovagal reactions. The table continues with respiratory, cardiovascular, gastrointestinal, musculoskeletal, helping you differentiate between the two or seeing where there is some overlap. And then recommendations about the next doses. Allergic reaction would basically be a contraindication to that next dose, whereas a vasovagal reaction or a large local reaction or some other vaccine reaction is not. More on interpretation. Is it moderate or severe, and what do these words mean? Moderate means the symptoms interfered with usual activities. A headache so bad that I was late getting out of bed, late to getting to work, couldn't eat my entire meal. That's moderate. Severe means the symptoms actually prevented usual activities. I couldn't show up for work. I skipped a meal. I couldn't fall asleep. Those are severe symptoms. When we talk about immunocompromise and contraindications and precautions, we need to understand that this may need clinician interpretation. An immunocompromising drug may be immunocompromising at one dose and not at another dose, may be immunocompromising with a length of time, but not for a short course, may be immunocompromising depending on its route. So we may need clinician interpretation as to whether this patient is immunocompromised. There's no hard and fast rule, and unfortunately, there's no quick test you can do in the vaccination setting to figure out whether a patient's immunocompromised or not. Allergic, you may need allergy consultation. As you saw, there is some overlap between a vasovagal response and allergic reaction, and patients may need the reassurance of an allergy consultation, as may you, depending on the situation. Tests and challenges may need to be done before a patient can proceed with vaccination. So in summary, we differentiated contraindications or prohibitions from precautions, which may require consultation. We identified best practices for finding true contraindications by using the independent experts ACIP table 4-1 to look up for each vaccine what their specific contraindications and precautions are. And we related best practices in interpreting those contraindications so you can put that table to use today in the office setting. I want to thank you very much for listening to me speak about this, but now I'd like to answer any questions or concerns that you have about contraindications and precautions with vaccines.
Dr. Jacobson, I have a quick question. And sorry if you answered this or said this already in your presentation and I missed it, but do you know, is there a way to print off those tables or just a way to print them off so that they're more easily accessible to people?
Yes, let me show you a trick that the CDC has on its website that I find very handy, both for searching as well as for printing. I'm going to share my screen again, and then we're going to go back to the website. And then I'm going to just show you, we're going to just step back and see that original page that I went to. So I'm going to walk through, I type in cdc.gov/vaccines. I go to healthcare professionals. I scroll down to that general best practices, and I want to show you printer friendly version. Now it's 195 pages, so you aren't going to want to print the whole thing, but actually bringing up this PDF, and I think you should all be able to still see this PDF. You can type in 4-1 and get to the table, and there it appears on page 52. And it's a printer friendly form. Now, admittedly, it's a lot of pages, but you can basically just say, I just want to print 51 through 58, or I actually recommend you print those footnotes, 51 through 59. You go up to your print instructions and just put in that page range and print those 9 pages. The reason I find this PDF very handy is if I know that somewhere in here they talked about the immunocompromising dose of prednisone, but I can't find it in the website, I often will find, well, I'm just going to search every time prednisone shows up here. Oh, and look at that. I searched and my first hit told me, oh, it's 2 weeks or more of 20 milligrams or more, or if it's a child, 2 milligrams per kilogram body weight of prednisone or equivalent. That's what I was looking for. So I find this PDF a very useful way to print out those contraindications, as well as to search that general recommendations for vaccine.
Great. Thank you for walking us through that. I do love the Control F function. I use that a lot.
Yes.